WZTS-LD 16 Hinton, Cozy TV.
Doc Talk with Dr. Paul Connelly is a production of TTV, which is solely responsible for the content.
Hello, welcome to Doc Talk. I'm Dr. Paul Connelly, and we are going to talk tonight about coronary artery disease. We're also going to talk a little bit about stroke as well. So in the United States of America, heart disease is the #1 cause of death. And when we think about that, heart disease actually accounts for 1 in 3 deaths. So in this country, 1 in 3 deaths is related to heart disease. It's not only the #1 cause of death in the United States, it's also the #1 cause of death worldwide. And that equates to that in this country, about every 40 seconds, someone is going to undergo a heart attack. So during this broadcast, there are going to be Americans having a heart attack. So what I'd like to talk about tonight with Dr. Charles Burdette, who's back on the show again with me, we're going to talk about heart disease, and we're going to talk about how to be heart healthy. In the month of February is actually Heart Awareness Month, and we actually dedicate the first Friday in February as to Wear Red Day. So Dr. Burdette, thanks for coming on the show.
Thank you for having me again.
Yeah, we're going to talk about heart awareness. You know, I know you've talked about this before, and being a primary care provider here in Fayetteville, I know that obviously you're going to see people in your practice with heart disease. So, you know, we just talked about some of the numbers, which are pretty staggering. #1 cause of death, 1 in 3 deaths in this country, heart disease. Every 40 seconds, someone's having a heart attack.
Absolutely.
So tell me, as a physician, what do you tell your patients on how to be heart healthy and try to prevent heart disease?
Well, that is our major, almost our major role that we do in every day. We talk to every patient about that. It was kind of scary that over 48% of Americans, adults, have some level of cardiovascular disease. And cardiovascular disease is really the term we use because that involves not only the heart but also the vessels, because the blood vessels are really the big piece of that. And there's many things that we need to do in looking at prevention. You asked me about what we look at. #1 in our area, smoking. Smoking and tobacco is a major issue. But probably the #1 cause is hypertension. We were talking before the cameras rolled about hypertension. We were talking about the numbers. Right now the goal is 120 over 80. That's where people should be. 130 over 90 is kind of the max, but really 120 over 80 is where the Joint Commission was wanting people to be. And that's the numbers that people should keep in mind when they're checking their blood pressures at home and trying to keep up with those things. Another aspect of heart health, of course, is cholesterol. Keeping your cholesterol numbers down. When we do our testing, people are always wanting to know what numbers should we be looking at. Well, total cholesterol is 200, should be below 200. LDL, which is our bad cholesterol, we should really be shooting for below 100. And then there's different tests for LDL that people may hear out there, but just knowing the LDL under 100 is where they should be at.
You know, when we talk about hypertension, you know, hypertension in itself is something that, you know, we think of it's called the silent killer because you really don't have symptoms with high blood pressure, so no one really knows what their blood pressure is unless you monitor that. And, you know, it's pretty staggering when we talk about that basically 48% of the U.S. population has some form of heart disease, and you think that that's going to be over 150 million people out there that are going to have that. And it's interesting when you talk about the 120 systolic, so 120 the systolic, that's when the heart beats, and when the heart relaxes, that's 80. But for, again, when I was taking my board exams, and maybe it's changed, but it was for every 1 millimeter of mercury elevation increases your risk of heart disease or an event by also 1%. So if your blood pressure is 10 points too high, then that actually increases your risk by another 10%. 20 points too high, 20%. 30 points too high, 30%. So these numbers actually matter, and I think it's important for patients that you can't manage what you don't measure. And I think that, you know, we got to make sure that the patients know their numbers.
Yes, sir.
So in that lipid panel, you know, it's interesting because you talked about the LDL. Maybe you can, for the audience, talk a little bit about, because I think a lot of people don't understand how you dissect that as a doctor. So if someone's sitting there in the barber chair and they say, well, my cholesterol is 210, and someone says, well, actually, mine's better than yours, mine's 200. Well, the 200 total may not actually be better than the 210 because there's a fractionation between the LDL and there's something else called HDL, right?
HDL, yes, sir. Yeah, when we look at those differences, the LDL, of course, is the low density. That one is the one that's it's taking it from the liver out to the body. And of course, cholesterol is used for many things, primarily for our cells, in order to renew those things. HDL is always picking up the cholesterol and bringing it back to the liver. So it's kind of cleaning up those things. So that's really, the total cholesterol is one number, but we have to look at all of those numbers. HDL should be 40 or above. Unfortunately, with HDL, exercise. That's why another one of the items that they want us to push on, of course, is exercise, because the only way to bring that up is exercise. There's not really a medication that brings your HDL up. LDL, there's many medications to help bring that down, and there's different levels, LDL-C, LDL-A, but right now LDL, as just understanding those numbers, is the one people should at least begin to understand.
So if I were to kind of put this in my brain, it would be like the LDL is the garbage, that's the trash on the street. The HDL, that's the good, that's the garbage truck picking up the bad and taking it off the street. So if you got not that much bad and you have a lot of good, so you don't have much garbage out there and you got a lot of garbage trucks, streets are clean, arteries are clean.
That's a good way to put it. I use a lot of car analogies in my practice because people seem to understand that. Absolutely, that's a good analogy. Just like with blood pressure, it's like I tell folks, like your oil pressure in your car. If you leave it run high and it keeps running high and you're not changing that filter, it's eventually going to cause problems. And that's a good analogy.
So when we talk about smoking being a risk factor, let's talk a little bit about not only smoking. I think there's something, and I'm going to bring it up, is, people will say, well, I've read the statistics in West Virginia, and the statistics will say that smoking is down. But if you really piece it out, vaping is up. And so basically, maybe you can comment a little bit about that, because some people say, well, I don't smoke anymore, Dr. Burdette, but they're vaping. I mean, vaping, does that have any issues or any consequences for heart disease?
Absolutely. One of the big issues with the cigarettes, of course, is the nicotine. Nicotine is a stimulant, and what does it do? It raises that heart rate, it raises the blood pressure. So they're not really getting away with not having those things. Vaping, of course, was always looked as a quote-unquote safe alternative to smoking. It really is not. There's a lot of carcinogens and things you're still being exposed to with vaping that are different than the ones you were getting with smoking. So you're really not getting out of those things. So absolutely. Some of the numbers we were just talking about, we were looking at the statistics from the American Heart Association earlier, and this is just a number I like to send out to the parents as well as other people. It says that in 2023, 12.5% of all U.S. high school students had smoked or vaped. Start adding those numbers up, you're talking anywhere from 50 to 60 million kids out there in this country are smoking or vaping, and they're trying to hide it. And then that starts them down that path of a lifelong addiction to nicotine. That is one of the hardest addictions in this country to get rid of. So, they're putting their heart and vascular system at risk when they're in their teenage years.
I agree. I've had patients in my practice, I'm sure yours as well, that were able to stop illicit drug use, but they still smoke. They can't stop smoking. They might be able to, they were doing pills, they were doing what have you on the street, but they were able to stop the addiction when it came to, let's say, an opiate. But when it comes to nicotine, much more difficult.
Absolutely agree. I had a young man who had some issues with some of the opiates and things like that, and he said he had an easier time when he was getting off of heroin than getting off of cigarettes.
So, other risk factors. We're in West Virginia, so I'm going to bring it up. You talked about smoking in childhood and teenage years, obesity, diabetes. I'm going to talk about that, and I know that diabetes itself, which I'm going to call on you to do an episode just on diabetes in general. But how does diabetes affect the heart, and also as far as risk factors? Maybe you can tell us about how sugars and diabetes play a role in someone that, when we talk about heart disease.
Well, in glucose or glucose metabolism issues such as diabetes that everyone thinks about, when that glucose is high in the blood sugar, it creates a reaction in the blood vessels. Remember, we were talking, Ben, about cardiovascular disease. We always have to remember the V, the vascular side of things. Sugar, as it gets higher and higher, causes a reaction in those vessels that then causes those cells to become more stiff. It starts to cause issues where the vessels can't react. It then causes it to be inflamed, which allows more of those plaques or that cholesterol to collect, which then causes the vascular disease to start to begin, and then it worsens. So the worse control you have of your diabetes, the worse your vascular disease can be. And so those are things you have to look at and think about. That's why we push so hard on keeping your numbers down. Cholesterol, diabetes, all that is all the same parts. Okay? So
with diabetes, there's a term, because I'll ask patients this, and some know and some don't. It's called a hemoglobin A1C. So tell me a little bit about, again, talking about the numbers, know your numbers. We talked about 120/80. We talked about LDL cholesterol. That's the bad. You want to see that under 100 you talked about. You want to see the good over 40. I mean, these are numbers I want people to write these numbers down. This is what you want to be. This is where you want to be at. Diabetes, A1C. What is an A1C, and what kind of numbers are we looking at there?
That's a very good point. All the numbers, are very important for everyone to know, and they should be writing these down. An A1C normal is below 5.6. For anyone who does not have diabetes, below 5.6. The borderline that you'll hear about that, or pre-diabetes, is 5.7 up to 6.4. Above 6.4 is where you basically are diagnosed as a diabetic. And it's one of those things, basically once you got to that point, you're a diabetic. You're diabetic from now on. Our goal is to have diabetics at 7 or less. So a A1C of 7 or below is basically putting you in a good position and good diabetic control. But I have people that are much, much higher. But those would be the numbers. 5.6 or below means you're normal. 7 is where our target is if you are diabetic. 6.4 is when you basically go in the door and you're now diabetic.
And I think it's important that you put that out there. It's almost kind of like, once you're an alcoholic, you're always an alcoholic. You may be an alcoholic in recovery. It's like with diabetes, maybe you're controlled, maybe it's diet controlled, maybe it's medication controlled, combination of the both. But I think people, they talk about, well, I was a diabetic, now I'm not diabetic. I think it's one of those situations where we know that if your A1C is 7% or higher, that's when you start seeing the adverse sequelae of the diabetes, the heart disease, the stroke, dialysis, kidney failure, disease of the eyes, all those things. So I think that's one of those things that's important that people understand. I also think people need to understand, and tell me if the statistics are still correct, that if you are a diabetic, like a female with diabetes, you have a 4-fold increased risk of heart disease than if you were a female without diabetes at the same age group. And I bring up women because I do think that women feel that somehow they are protected from heart disease because it's only a disease of men. But again, the number 1 cause of death in the United States of America for not only men like us, but for women is heart disease. So
absolutely, you're right on the mark there, Doc.
So we're coming up on a break. We're going to go to commercial break. I want people to stay tuned because when we come back, I'm going to have Dr. Burdette talk to us about the signs and symptoms of heart disease. So then you'll know if this is something that you may want to seek additional attention, and then we're going to talk about additional testing. So you're not going to miss this. Stay tuned and we'll be right back.
You're watching Doc Talk with Dr. Paul Connelly on WZTS 16 Cozy TV. Stay with us. We'll be right back after these messages.
Vandalia Health is proud to be a West Virginia-owned healthcare system, bringing together the hospitals and providers of CAMC, Mon, and Davis. We are dedicated to enhancing the health of our communities through clinical excellence. Our compassion and commitment remain the same with people you know and trust to care for you and your families. With more specialists, hospitals, and outpatient locations, we're delivering expertise and state-of-the-art care. Vandalia Health, expert care close to home.
Welcome back. Doc Talk with Dr. Paul Connelly continues on WZTS 16 Cozy TV.
Hello, welcome back to Doc Talk. I'm Dr. Paul Connelly, and tonight's guest is Dr. Charles Burdette, primary care physician, family practice here in Fayetteville, West Virginia. And we've been talking about heart disease. And so we've been talking about know your numbers. We've been talking about that good cholesterol, want it high, over 40, bad cholesterol, want that low, under 100. Blood pressure, 120 over 80. We definitely want to keep that down. High blood pressure, risk factor. We also talked about diabetic, A1C, under 7%, get it down. But another number that we didn't really talk about, and you mentioned it to me at the break, and we failed to talk about, or I failed to talk about, is exercise. We know that people that perform some form of exercise can dramatically reduce the risk of heart disease. So tell me a little bit about exercise and how much should we be exercising?
Absolutely. Well, exercise, when you look at the American Heart Association and some of the other groups, they recommend that people should work themselves up to about 30 minutes of aerobic exercise per week. Now that means 5-7 minutes a day. But I've heard many cardiologists just say just starting with a minute a day, just to get out, get your heart rate up. Even if that just means that you walk around your dinner table, your dining room table 3 times and get your heart rate up, that's what you should be doing. Because it will help with some of those things that we're talking about with the HDL. And then of course also that would help with weight. Weight is a big problem. You were mentioning obesity earlier. I think again, since we're talking about the numbers, people should know what those numbers mean. BMI of course is basically based on your height, your weight, your sex, and looking at what the lean body weight should be. The numbers to know: if you're below 27, you're normal. Okay? If you're between 27 and 30, that's considered overweight. You should be doing things to get that down. If you're above 30, you're 30 to 40, that is considered obesity. That's the obesity. And then unfortunately there's other numbers, and that's if you're above 40, that's called morbidly obese. And the reason it's called that, as you well know, Doc, is because people above those numbers are going to have problems related to obesity, and such as the things we've been talking about tonight: cardiovascular disease, diabetes. Then you also look at other problems such as vascular disease, heart failure, and then of course arthritis. Those are just some of the things to highlight.
Sleep apnea.
Sleep apnea, that's something else that affects cardiovascular disease, is that sleep apnea that affects your weight. So folks who have that snoring husband, wife, grandma, grandpa, uncle, aunt, whatever it is, they really should get checked out, because sleep apnea puts a lot of stress on the cardiovascular system.
Yeah, and I think you're right. Obesity, big neck size, overweight, snoring. Again, your oxygen level goes down at night. The heart does not like that. As human beings, the heart does not like, when the oxygen level dips down, and patients are not aware of that because they're sleeping. They don't really know. So it's usually going to be a family member or a significant other, a spouse, that may be the one that alerts that to the family doc. So we've spent quite a bit of time talking about know your numbers, and we've talked about that. Now you have a patient that comes in the practice, and we're going to talk a little bit about symptoms. What would alarm you or concern you as a physician that someone's symptomatology may be reflective of heart disease?
Excellent question, and we were discussing that earlier. But it's one of the first things that we always talk about, that almost everyone concerns about cardiovascular disease: shortness of breath. When they're short of breath, especially when they are getting short of breath with activities they've been able to do very easily over the years, when they can't go up a flight of steps without having to hold on to the railing and have to catch their breath halfway up or at the top. Any of those kind of activities are what we're looking at. The other issues, if they're having palpitations, if they feel like that heart's beating fast or beating really slow, those are signs that we need to that they need to get checked out. Lightheadedness, dizziness, that's usually a very common complaint, but can be related to cardiovascular disease, and could be some of the early signs that people kind of will, not pay attention to. They'll for lack of a better term, they'll blow them off. They'll ignore them or say it's not a big issue. Some of the other things, of course, that we always see is edema, people swelling in their legs, particularly from the knees down, in their feet, their ankles. Their socks are disappearing inside their legs. Those are things to be concerned about. And then the other ones that people always know about, and that's chest pain. When people are having that pain, particularly in the center of their chest, going up into their neck or their left shoulder, or into the middle of their back, those are concerns. But we were talking at the break about, now chest pain is not always one that we see with ladies. Women can come in and have what we call a silent heart attack. That's where they'll have all kinds of other symptoms. We've been talking about short of breath, they don't feel good, those sort of things, but they don't necessarily have chest pain.
Well, one thing too is, we talked a little bit, while we were at the break, was that, we've seen individuals with diabetes. And tell me a little bit about that, because, we talk about diabetes being a risk factor, but a lot of times these people that are diabetic, again, they won't necessarily come in with that substernal crushing chest pain, that term we call angina, the elephant sitting on their chest. Women that have diabetes, tell me about that subgroup of individuals.
Well, that subgroup, again, as I said, will come in. They may not have chest pain. A lot of times, I did a little bit of ER time, they always think they have the flu. They just feel bad. They feel like they've been, quote unquote, run over by a truck. They are short of breath. They can be nauseated. They'll have pain sometimes not in their chest, but in their back, between their shoulder blades, is a common complaint in that group. And unfortunately, with the neuropathy and things that comes along with long-term diabetes, that's why that chest pain doesn't always kind of show up. Again, you get those other symptoms of a heart attack that we've all know, chest pain, nausea, the sweatiness, where they're that cold sweat that they talk about. Those are the symptoms that people should be dialing 911 and get checked out.
Yeah, I think about, one of the things I think about is just dyspnea, which means shortness of breath with exertion. Sometimes we'll say, so where is your mailbox at? Well, it's down the driveway. And someone will say, well, I used to be able to walk to the mailbox and back without stopping. And now I have to stop once, twice. That may be a sign of heart disease. You have now exertional shortness of breath. Or I used to be able to walk up one flight of steps without having to stop. And now I can't walk up a flight of steps. And those are all things that are concerning, that someone may have some underlying heart disease, not necessarily chest pain, but just the fact that they just get short-winded quicker.
Absolutely.
So someone now has all these symptoms, okay? Yes, and now you are the doctor. Dr. Burdette, I have these symptoms. I get short of breath. When I walk out to the mailbox, I can't walk up a flight of steps like I used to. I have difficulty mopping the floor and doing household chores. What do we do now? As a healthcare provider, now what is the next step, and how do we evaluate that patient for heart disease?
Absolutely. Well, when that patient comes in and sees me or sees any other provider, one of the first things we're going to do is, of course, get lab work. We've talked about all the risk factors, the cholesterol, the diabetes, and those sorts of things. We want to check all that. Kidney disease that you've mentioned, liver disease has been mentioned. We need to check and make sure where they're at in those areas, or any of those conditions involved. An EKG, doing the electrocardiogram, so we can see if there is any electrical signals that are being disrupted. And that can be a sign of issues with the heart. That can be a sign that they're not getting good blood flow. Are they having vascular problems? The coronary artery disease, the blockages that people hear about that have to be stented or have a bypass. Those can be signs. Once we complete with that, sometimes if we can, or if it's available, we'll put them on a Holter monitor, that 30-day monitor, to kind of watch to see, is this an arrhythmia? Is there something on there which can be indicative of the cardiovascular disease? So those are some of the early tests. Then the specialists get involved, and that's when we start looking at things like an echocardiogram, the ultrasound, to look at the heart. Is there any valvular disease? Is the heart moving the way it should be? Are the valves opening and closing? Those sorts of things. Is everything moving the way it should? Those are what we look for in echo. After that, some of the new testing, of course, we probably look at a stress test next. But nowadays they're actually doing more of what's called the CT angiogram of the coronary arteries. That's becoming more and more prevalent as more and more of those scanners that have the resolution that we need to see that, or being able to see small enough items for what the resolution means. That's becoming more and more common, having those tests. And the stress test, of course, everyone knows about getting up on the treadmill, trying to get your heart rate up, and then they give you the dye, the nuclear tag, to check that. It's a sugar with a nuclear marker on it that we can then do the scanner and see, is everything moving? Is everything getting blood flow as it should? And then after those tests, if those tests still aren't showing us what we need to show, of course, next up is the heart cath. And that's where you go to the cath lab and have the check to see, is the blockage there and where is it and what's our next step?
And the catheterization, that's the gold standard. That's when we talk about not only identifying a possible lesion or blockage, then stenting. Maybe walk back to the stress test, because I have patients that, okay, they undergo an EKG. That's the electrocardiogram, and that's looking for heart tracings. But some individuals, their EKG is just abnormal. It's not helpful. They have what's called a bundle branch block, so they're not really interpretable. And also, an EKG in your office is going to be at rest. And so, we're talking about stress. So maybe you can talk a little bit again about the difference between an individual who's watching this show and says, "Well, I can't walk. I'm obese. I can't. I got arthritis. I got back pain." There's something called an exercise stress test, and then there's something called a non-exercise or a chemical stress test. And then maybe you can talk about this tracer that's entered into the body. There's something at rest and stress, and how does that actually work? How does that show up on imaging, which would then allow the provider to see if there's a blockage or not? What exactly is happening with those tests?
That's an excellent point. In a stress test, the exercise, of course, as I said, was a treadmill. For those individuals and those patients who aren't able to do that, again, as you said, there is a chemical we can give. The patient lies on a couch or a bed. They're being monitored. Of course, you have the EKG, as you were saying, because again, the stress part of that is stressing the heart to see what part of the heart is getting blood flow or is not. Is there a blockage? Is there not? But the chemical, they can give that, which raises the heart rate up to where we want it. There's a target rate, and it has to be there for a certain amount of time. And once it's there, they give you that tracer, which is basically a nuclear tag sugar. That sugar, of course, goes through the body. What does the muscle need? The heart, of course, is a muscle. What does it need to work? It needs sugar. So that sugar can go in there, and when that scanner that kind of goes around you, anybody who's had a stress test or had a family member or anyone have that, they see that little scanner goes around the body. Well, they can catch that nuclear tag as it leaves the sugar, and they can see areas of the muscle that may not be getting blood flow as it should, may not be moving as it should. It's an amazing device when you actually sit back, as I did when I was a student and a resident, watching those things and seeing how that machine works. It was fascinating how that is, and the information we can get from that. So that was an excellent question, sir.
Oh, well, thanks.
You're very welcome.
Well, that is something that, we do offer at our local hospital here at Plateau Medical Center. We do offer stress testing there. And stay tuned, because we are looking in the future to be able to do the cardiac CT scan there as well. Well, it looks like, we're getting ready to come up at the end of the show. So again, Dr. Burdette, know the numbers, know your blood pressure, home blood pressure monitoring. I know that, we've talked about that. Make sure if you're watching broadcast, get a blood pressure cuff. Know what your blood pressure is running, because you can't manage what you don't measure, and your facts are your friends. So you need to know the facts. Also, check your A1C, get routine blood work, go see your doctor, get that LDL, check the HDL out, do some exercise, weight loss, all those things, stop smoking, and hopefully if you do all these things, you can delay early and preventable coronary artery disease.
Absolutely. I always just say, just go see your doctor. First step.
Well, that's first and foremost, go see your doctor. Well, Dr. Burdette, I really appreciate you talking about coronary artery disease. The month of February, each and every year, is Heart Awareness Month. First Friday in February is Wear Red Day. I'm Dr. Paul Connelly. I've been with Dr. Burdette. We've been talking about heart disease. Until next time, Have a good night.
Miss an episode of Doc Talk? You can watch Doc Talk with Dr. Paul Connelly anytime on WZTS TV's YouTube page or on Facebook. Catch the latest episode or explore our full library of past shows. Already watching online? Check us out on WZTS Cozy TV, weekdays at 7 p.m. However you watch, thanks for tuning in.